there, this presentation is a joint collaboration between Heart Research Australia, specialist staff from Royal North Shore Hospital and North Shore Private Hospital to provide you with important information about your cardiac care.
Cardiac rehabilitation forms an important part of your recovery journey. Before you go home after having been treated for a heart event at Royal North Shore and North Shore Private Hospitals, you'll have an opportunity to meet with a member from the Cardiac Rehabilitation team. They will talk to you about your recovery, your return to work, diet, exercise and general daily activities. They'll also encourage you to follow up with a cardiac rehabilitation program and give you contact details of the nearest rehab centre in your area. You should take an active role in this discussion, which impacts on how to manage your ongoing health and reduce your risk of a further heart event. Think of this pre-discharge contact as the beginning of a partnership between you and your healthcare team to make all the arrangements to regain and maintain your good health.
Cardiac rehabilitation provides exercise, education, as well as psychological and emotional support. Our aim is to help and support you in your recovery following a recent heart event or heart surgery. After you leave hospital, the main focus of cardiac rehabilitation is to support you in your journey back to good health. This is done by helping you to identify your risk factors and then assist you to develop goals and strategies to reduce your risk in the longer term. Cardiac rehabilitation services are available at many hospitals throughout Australia. They provide a variety of education, exercise and support programs. But people often lead very busy and often stressful lives, but it's important to try and prioritise your health and establish and maintain healthy lifestyle. Exercise and healthy eating are very much at the centre and should be part of your routine, a bit like cleaning your teeth. In particular, regular exercise has a vital role to play in reducing your risk of another cardiac event and has many benefits in terms of your overall mental and physical well-being. It is important to recognise that exercise is something really positive that you can do for your own health. In addition to reducing your risk of a heart attack, it can also reduce your risk of a stroke, dementia, and some cancers, as they all share similar risk factors. Of course, it is important to exercise at the right level for you, and this will be assessed as part of the cardiac rehabilitation process.
The challenge, of course, is that nutrition, exercise and achieving life balance can be hard, but that's where cardiac rehab can help you. Cardiac rehab at Royal North Shore Hospital and North Shore Private offers a very flexible program, allowing you to take from the program whatever is helpful or relevant for you. There are various options. It may be just a one-off follow-up appointment after you leave hospital with one of our cardiac nurses and an exercise physiologist. At this appointment, we can review your progress and answer questions you may have about your heart condition or your recovery. We can help you to identify your particular needs and what will work for you in terms of your cardiac rehabilitation. One option might be to give you an exercise program to follow at home and a referral to a relevant health professional, for example, a dietitian. We also offer a comprehensive outpatient education and exercise program. Again, very flexible, so you can choose if you want to attend one or all of the sessions. Some people may also feel a bit overwhelmed and experience periods of anxiety or depression following on from a cardiac event. Cardiac rehab helps to normalise some of these emotions. Participants often benefit from the shared experience and mutual support from others in the group. Our objective is to work with you to achieve your goals. A healthy lifestyle has a big role to play in your recovery and ongoing health.
When it comes to cardiovascular risk factors, your diet plays an important role. Here are a few heart-healthy eating tips which may help you maintain your heart health. Amount and type of fat in your diet can affect your blood cholesterol level. So limit the intake of saturated and trans fats and replace them with healthy polyunsaturated and monounsaturated fats. Make good fat choices with nuts, seeds, avocado, olives, and healthy oils. Include fruits and vegetables in your everyday diet. They're packed with vitamins, minerals, and fibre. Having a diet rich in fibre can reduce your cholesterol level and also keeps you feeling full for longer, which is also important in maintaining a healthy body weight. The best sources of fibre are fruits, vegetables, nuts, seeds, whole grains, and legumes. Omega-3 fatty acids have a vital role to play in maintaining heart health. Fish is one of the best sources of omega-3. We recommend Australians to have 2 to 3 serves of fish per week. Choose fresh foods whenever possible. Try to cook at home with fresh ingredients and limit the intake of highly processed foods and takeaways, as these foods contain high amount of salt. Being able to read and understand food labels is a useful skill to help you make the right food choices. Using nutrition information panels and ingredients lists are good ways of comparing similar foods so you can choose the healthiest product.
Here are some healthy tips which may help to improve your health and reduce your risk. So first of all, know your risk. Do you have high blood pressure? Do you have high cholesterol? Are you overweight? Know your numbers. It's really important that when you go to see the doctor, you know what your blood pressure is, you know what your cholesterol is, so you can take an active part of managing your health. Eat a healthy, balanced diet, in particular portion control. Watch your weight and that bulging waistline. We know from the research that if we carry excess weight around our waist, it puts you at greater risk of heart disease. Don't smoke, and really importantly to take your medication as prescribed. And keep active, really important to have an active lifestyle, move more, sit less. And finally, life balance. Beware of that busy trap where everybody often gets caught up in the busyness of life, and then the first thing that actually goes out of the door is exercise and healthy eating. So really important to be aware of that.
I was having a fantastic day. I'd been for a run, I'd been with the kids, and I went for a walk, and I could feel when I got home my heart was really pounding, and so I went, and we have a blood monitor at home, a blood pressure monitor, and my blood pressure was very high. I rang up the hospital and they said get in straight away. When I got to the hospital, they had to intervene and gave me medicine to actually lower my blood pressure, and then after that I was told that I had to have a bypass. This was a real shock to me because I'm young and very active, and I couldn't believe that it was happening. The information which I received from the doctors was really clear in terms of the procedures, in terms of what was going to be happening, and in terms of the recovery time. After you've had a major operation, you're very vulnerable, both physically and mentally, and you need a team behind you. You need your family, you need your friends, and you need your medical team all working together. What the rehabilitation process gave me was a structure to be able to commit to a better lifestyle, better exercise, and actually to have a sense that I am going to get better. The rehabilitation team keeps you in contact not just with the medical team, but also with other patients who are going through exactly what you're going through. There's so much really to learn about the heart, and what the rehabilitation process does is it gives you a structured way to do that at your own pace. You can check in at any time, and they're helping you all the time. They're helping you with your wound management, they're helping you with your well-being, they're helping you with your diet. All along the way, you can get a sense that you're in the hands of professionals who are really out there looking after you. And for me, that just gave me fantastic confidence, and I'm so grateful.
And finally, if you have any questions or you would like to find out more about cardiac rehabilitations closer to you, you can call us on 02 9463 1704.
Heart Research Australia was established in 1986 by cardiologists at the Royal North Shore Hospital who wanted to reduce the high death rates from heart disease. The foundation supports seed funding for researchers to test innovative new ways to prevent, diagnose and treat heart disease. During your treatment, you may be asked to participate in one of the research studies conducted by our academic cardiologists and their teams. We encourage you to consider this, as cardiology is one of the most rapidly advancing fields, and improved treatment of coronary artery disease through research has the potential to save many lives in the future. For further information, please visit the Heart Research Australia website.